Oh snap, active lifestyle transforming minds, bodies, and business opportunities. Because we know health is wealth. Constipation can be caused by various factors, and while lack of fiber in the diet can be one of them, it is not the only cause. Constipation occurs when stool moves too slowly through the digestive tract, and as a result, it becomes hard and difficult to pass. Other factors that can cause constipation include not drinking enough water, lack of physical activity, certain medications, changes in routine or diet, and medical conditions such as irritable bowel syndrome or hypothyroidism. Therefore, it is important to consult with a healthcare professional if you are experiencing frequent constipation to identify the underlying cause and develop an appropriate treatment plan. There is no one single main cause of constipation, as it can be caused by a variety of factors. One of the most common causes of constipation is lack of fiber in your diet. Some people say not consuming enough fiber can make stool harder and more difficult to pass. Fiber helps your poop by adding bulk to your stool and promoting regular bowel movements. I'm questioning this because if you are constipated, do you really need to add bulk to your poop? Fiber can cause stomach bloating and cramps in some people, particularly if they suddenly increase their fiber intake or consume too much fiber at once. This is because fiber absorbs water and swells in the intestines, which can cause bloating and discomfort. Some types of fiber, such as insoluble fiber found in wheat bran and certain vegetables, can be more difficult to digest and may cause gas and bloating. On the other hand, a lack of fiber in your diet can make you constipated because your stool becomes too hard and dry. Without enough fiber to add bulk to your stool, your digestive system has a harder time moving stool through your intestines. This can cause stool to become compacted and difficult to pass, leading to constipation. When stool remains in your intestines for too long, your body continues to absorb water from it, making it even harder and drier. This can exacerbate constipation and make it even more difficult to pass stool. Before adding more fiber to your diet, here are other causes of constipation you should acknowledge. Dehydration. Dehydration can cause constipation because it reduces the amount of water in the stool, making it harder and more difficult to pass. Normally, the large intestine absorbs water from the stool as it moves through the digestive tract, which helps to make the stool soft and easy to pass. However, if a person is dehydrated, the large intestine absorbs more water than it should, which can cause the stool to become dry, hard, and difficult to pass. Dehydration can also slow down the movement of stool through the digestive tract, which can contribute to constipation. When stool moves too slowly, more water is absorbed from it, making it even harder and more difficult to pass. This can create a vicious cycle where constipation leads to further dehydration, which worsens the constipation. Lack of physical activity. Not getting enough exercise or physical activity can slow down bowel movements and contribute to constipation. Lack of physical activity can cause constipation because regular exercise helps to stimulate the digestive system and promote bowel movements. Exercise helps to increase muscle activity in the intestines, which can help to move stool through the digestive tract more quickly and efficiently. This can prevent stool from becoming too dry and hard, which can contribute to constipation. When a person is inactive or sedentary, the muscles in the digestive system are not stimulated as much, which can slow down the movement of stool through the intestines. This can lead to stool becoming more dry and hard, which can make it more difficult to pass and contribute to constipation. Certain medications like painkillers, antacids, and antidepressants can contribute to constipation in a few different ways. Painkillers, such as opioids, can slow down the movement of stool through the digestive tract, which can lead to constipation. These medications work by binding to specific receptors in the digestive system, which can slow down the contractions of the muscles that move stool through the intestines. This can cause stool to become more dry and hard, making it more difficult to pass. Antacids, which are used to treat heartburn and indigestion, can also contribute to constipation. Many antacids contain aluminum or calcium, which can bind to stool and make it harder and more difficult to pass. Additionally, some antacids can reduce the amount of stomach acid, which can slow down the digestion and movement of food through the digestive tract. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, can also contribute to constipation. These medications work by increasing the levels of serotonin in the brain, which can affect the muscles in the digestive tract. This can lead to slower movement of stool through the intestines, which can contribute to constipation. Medical conditions. Certain medical conditions can cause constipation by affecting the normal functioning of the digestive system. 3 common examples are irritable bowel syndrome, IBS, hypothyroidism, and Parkinson's disease. IBS is a chronic digestive disorder that affects the large intestine. It can cause a range of symptoms, including abdominal pain, bloating, and changes in bowel habits, including constipation. The exact cause of IBS is not known, but it is thought to be related to abnormal muscle contractions in the intestines and/or an oversensitivity to certain foods and stress. Hypothyroidism, a condition in which the thyroid gland does not produce enough hormones, can slow down the digestive system and cause constipation. This is because thyroid hormones help to regulate the metabolism and muscle contractions in the digestive system. When thyroid hormone levels are low, the digestive system may not function properly, leading to constipation. Parkinson's disease is a neurological disorder that affects movement and can also cause digestive problems, including constipation. This is because Parkinson's disease can affect the muscles in the digestive tract, making it more difficult for stool to move through the intestines. Other medical conditions that can cause constipation include diabetes, multiple sclerosis, and certain types of cancer. It is important to talk to your doctor if you experience persistent or severe constipation, particularly if it is accompanied by other symptoms, as it may be a sign of an underlying medical condition that requires treatment. It is important to identify the underlying cause of constipation in order to develop an appropriate treatment plan. Be sure to pay attention to your body. Thank you for watching. Please like, share, follow, and comment so we could reach more amazing people.